You ready?
Yeah, hey. This is nicer than I've done some of these before. This is easier.
Yeah. So first off, just tell us who you are and what you do.
My name is Daniel Richard Stevenson. I'm a cardiac, thoracic, and vascular surgeon. My name generally gets put out as Richard, and that's because I grew up in Jonesboro when it was a small town. My dad's name was Daniel. Tough to have two Daniels at the time, so I became Richard.
How long have you been a cardiac thoracic surgeon? Long time?
Yeah, a long time, 25 years or so. You know, someone once asked me, how old are you? And I thought, well, I'm as old as my tongue and a little bit older than my teeth. So.
Yeah. You know, why did you choose to do a video like this, to kind of introduce yourself or reintroduce yourself?
Well, you know, for one thing, y'all suggested it, and I figured you know more about it than I do. But in general, I elected to relocate my practice to another location, and along with that went some suggestion that I'd retire. And I wanted people who might access a website to know that I hadn't retired and that I was still working and still being productive and still wanted to be productive. And it seemed to me that in the current way that information is disseminated, while radio and newspapers are still quite valuable and credible, a lot of people go to the web. And so I thought that this might be, maybe I should say I agreed with you, this might be a better way to do it.
So tell me a little bit about your training and where you went to school and med school. And
I actually had an academic scholarship to Arkansas State, and I was from Jonesboro, so I could still stay at my home and not incur debt. I came from a working class family, and we had plenty to eat, a warm and dry house, but we didn't have an incredible amount of money to go into debt over. And I was accepted to the University of Arkansas for Medical Sciences in Little Rock, and then stayed there for both general surgical training and my cardiac and thoracic surgical training. I actually thought that I was going to do non-cardiac thoracic surgery during my training. I had a really immense interest at the time in, not that I don't now, but at the time I was really interested in lung cancer surgery and the prospects of the treatment of lung cancer, which we're now seeing, by the way. We're seeing some of the treatments that I foresaw would come back when I was doing my thoracic training. But I swapped into cardiac because in the very middle of my thoracic surgical training, my father had a severe episode of angina. I thought he was going to have a heart attack before I could get him to the hospital. And he had 5-vessel heart bypass performed by actually one of my mentors, and it gave him his life back. I mean, Dad was in his middle 60s at the time and had become almost sedentary because he didn't recognize what was going on with him. When he recovered from his heart surgery, he was back out on his tractor, you know, ruddy-faced again. He planted a 100-tree peach orchard. I can remember him riding my older son, my oldest child, on the tractor after his heart bypass surgery. And that changed my whole direction in my training because I saw the difference it could make in a life.
Mm-hmm.
You know, even if it wasn't going to make a difference in his length of life, which it did by 20 years, it just gave him his quality of life back. You know, live your life on a day-to-day basis, and I saw marked improvement in his life.
After you went to Little Rock, you know, you probably could have gone anywhere in the world, or anywhere at least in the United States, to practice. Why did you come back to your hometown?
Well, I don't know that I could have gone. You know, I don't think the Mayo Clinic was just waiting for me to get there. You know, but I actually had my first job as an assistant professor of surgery at the LSU Medical School in Shreveport, Louisiana. I was recruited there by a surgeon who had been there only about 2.5 years, and he had rebuilt that program in cardiac surgery and vascular and thoracic, and to the point that he couldn't do it all. And at the time, heart surgery was done only in 2 towns in 2 cities in Arkansas, Fort Smith and Little Rock. And Little Rock at the time probably had enough cardiac surgeons when I was completing my training that they didn't need anyone else at the time. And I also thought that the next place that they would do heart surgery in Arkansas would be in the Fayetteville area. And one of my colleagues, who was a cardiologist, was already up in Fayetteville, and he was kind of planning on me being able to go there when they started their program. And I thought that it would be a good thing for me to go to another academic institution where I would get some experience training the younger residents, and then also I would have plenty of hearts to do to bring myself up into an experienced surgeon before I came back to Arkansas. As it turned out, Fayetteville was not the first place. And then later on, as it turned out, one of my mentors, in fact, it was the one that had operated on my dad, wanted to relocate to Fayetteville because he liked the hogs. And so he went there and started that program. And then I relocated back to Jonesboro because of family. I mean, I'm from here. My parents were still here. My wife's mom lived in Searcy. There's a book by Somerset Maugham where an older doctor is advising a young man, and he says, find the place you want to live and there hang out your shingle. And that's what I did.
What are some of the things that you love about being a surgeon, and especially a thoracic and vascular surgeon?
I think it has to do with making a difference. I mean, just as I saw my dad's quality of life improve dramatically, give him his life back so that while he was alive, he could be busy and be out doing the things that he loved doing. And as I've gotten older and now have a substantial number of patients that I've cared for, what I really love is to have someone that I've operated on come back and see me 6 weeks when I'm saying, okay, we're removing restrictions, you can begin to do. I get the best fulfillment when they say, you know, I'm a lot better. I'm a lot better than I was. The next best thing is for me to be standing in a hall, you know, and I'll have on my white coat in the hospital, and someone will say, hey, Dr. Stevenson, do you remember me? You operated on me 12 years ago, and I'm still doing great. That's a kick.
I understand that you've recently moved your practice.
Yeah.
And
Yeah.
you're practicing at NEA Baptist.
Yes. Yes.
What has that experience been like, having to, you know, just kind of change your venue and change what you've known for so many years?
I mean, someone once said that anytime you try to do anything worthwhile, or anytime you try to do anything that's going to make a difference, there are going to be obstacles, and you may have to experience obstacles that you have overcome in the past. I relocated my practice in large measure because I'm an older guy, and I come from a time when doctors had practices and they maybe would take their patients to the hospital. Medicine is changing, and I recognize that it's changing. But the NEA Baptist administration and the NEA Baptist Clinic offered me what I consider to be an opportunity to continue to have my practice and be associated with them at a time when I was not yet ready to stop practicing. You
also practice in more than just your clinic in Jonesboro.
Yeah. And that's and anyone who's watching this who might be from up around Pocahontas, Dr. Drew Jansen and I went to college together, and we were roommates our first year of medical school before he married Becky. And when I came back to Jonesboro, I had not been asked to come here, and at that time it was kind of unusual for a doctor just to decide to come to Jonesboro. Normally the hospital recruited you, or another established physician would recruit you, and then you were kind of excited to have someone just show. That wasn't exactly the way things were done, and so I was looking for support, and by that I mean I was looking for people to give me referrals so that I could be able to demonstrate my capabilities. So I went to see Dr. Jansen, and I said, relocated here, and by now I'd had 7 years of experience. I'd done over 1,000 hearts by the time I first came back to Jonesboro. And I asked him, can you send me some work? And he said, well, sure, I can do that. But he said, what you might want to do is start a satellite clinic up here and come up and see the patients from around here to keep them from having to drive to Jonesboro, because you're going to be seeing older people. And for them to take an hour to drive to Jonesboro and hunt for a parking place and then come in and maybe wait on you for 15 or 20 minutes and then see you for 15 or 20 minutes and then drive you, wipe them out. So why don't you come up here? And I told him, I said, listen, if you and your colleagues will refer me some work, I'll run a satellite clinic here, and I will always run a clinic here as long as I practice. One of my favorite quotes is from Bob Dylan, when someone says, you're 70 years old, you've got umpteen jillion songs that you've written, that you get residuals from everybody else recording. Why are you still striving? Why are you still performing? And Dylan said, and I thought it was just, he said, I made a deal with destiny. I'm holding up my hand.
I like that.
I liked it too. I made a deal with Drew Jansen, and I'm holding up my hand. And then I did the same thing in some of the other towns around where I knew doctors.
So you have clinics in Pocahontas, Paragould, Walnut Ridge, and Piggott.
Piggott.
For anybody that, is looking for a surgeon for their mom or their dad or their aunt or grandma, or, what would you want to tell them about yourself and how to, how to choose a surgeon and what to look for?
Well, I operated on someone today, and what I told them before they went into the operating room is, you'll get the best job I can do every day, all day, and in general, that's good enough. I would want to tell, and maybe I'll look at a camera on this one, I would want to tell anyone a couple of things. One is, I'm paraphrasing Mark Twain, who was once reported in the media to have been dead, and he told a group of people to whom he was lecturing that the rumors of his death had been greatly exaggerated. So if you heard that I retired or that I'm no longer in the area, that's not right. And I'm still at the same old phone number that I had now for 20 however many years. And the second thing I would say is, if you have a cardiac catheterization at a hospital that's not where I'm practicing now, which is NEA Baptist, and you would like me and my team to be involved in your care, you want us to take care of it, You simply need to ask your provider where you are to call me and transfer you to my care. And they will do that. They have no reason not to do that. And they should not argue with you about it. You know, you're entitled to the care that you want by the people that you want. That would be a message that I would want known.
Thank you.
I appreciate it.